So we thought about if organizations believe they're patient-focused, if organization believes patient-centricity matters, how do you actually get after that? So the approach that we took was to really think about, let's start and look first within our four walls. So the first thing in terms of the point I'll leave you with is, if you're, in my mind, in my journey, if you're going to be successful in changing the approach to patient centricity to be able to deliver on real value, you really got to look inside first. And why is that important? So many of us believe, by virtue of being in the industry, we are patient-centric. We do patient advocacy summits. We do market research. We engage with patients. We talk to them. We're patients. Our family members are patients. We really talk a lot about why we are good at it. But when you really do a deep dive, I think you'd be surprised to find what we're not good at. So for me and other people that I've worked with, the decision was we needed to really go outside and think differently in terms of assessing our four walls in terms of how patients interact with us. So what we decided to do was hire this guy named Jim Merlino. Jim Merlino was a physician, or is a physician, but he was at the Cleveland Clinic. He wrote a book called Service Fanatics. He was tapped by Dr. Cosgrove of the Cleveland Clinic to improve the patient experience at the Cleveland Clinic. I'd recommend you read the book. We can spend all day on that. But what they did is they took a series of steps to really evaluate how, at the Cleveland Clinic, they can improve the patient experience. They're delivering amazing clinical care, but the patient experience is way down here, which was a huge dichotomy. He changed the process at Cleveland Clinic, wrote the book, and then went to a firm called Press Ganey. So Press Ganey is really focused on the provider side. So the feeling for us is, let's bring in someone from the provider side, doctor side, hospital side, evaluate us through that lens in terms of patient focus. So we brought him in, and his team evaluated the four walls of the company. And as part of evaluating that, he then provided us feedback. We felt we were on the leading edge of patient focus. We felt we were on the leading edge of patient centricity, that we did it really, really, really well. He came back to us and said, we are really, really, really bad, which was stunning. So then he went through example after example about how we really were disconnected from the patient and really disconnected from driving real value that was meaningful for the patient. So I said, well, explain it to me. So I'm going to give you some anecdotes. I know Doug Nolan is presenting on a panel yesterday, so I'm stealing some, or today, so I'm stealing some of his thunder. But simple things. How many phone numbers do you think it took for a patient to call the company to get an answer? How many numbers do you think we had? 4, 10, 6, over 50. A patient could call over 50 phone numbers to be able to contact someone at Estelle's. Why? I shouldn't have said Estelle's, my previous company. So why? Why was that? Because brands have phone numbers that are associated with websites for more information. You've got patient's assistance numbers, you have medical information numbers, you've got numbers and numbers and numbers. And we also like our proprietary numbers. If a number spells out our brand, woo-wee, we hit the home run, right? We own that bad boy forever. Even better, if we can get a website domain that lines up with our name and our number, we've killed it, right? So that's how we've thought for years. It's brand centricity, not patient centricity. We also outlined a variety of other areas that we were way off in terms of how we were doing informed consent, health literacy, and other elements, including the fact that one story which really sticks with me to this day was that when you think about a patient and you're providing them educational materials, if we can find a way to stick our brand on there, we do it, right? We want to brand our stuff. Well, how does it feel if you have a branded patient material that someone pulls out in front of their friends? They've just advertised, hey, I'm on this product, right? That would never happen in a hospital setting or in a provider setting, right? So the lens they took to dissect our patient focus was incredible in terms of providing a sense of humility. When we were done with that meeting, I said, great, when can we start working? He says, I'm not working with you. I said, what? How many times have you guys worked with a consultant that says they're not going to work with you? Has that ever happened? I was blown away, right? He's like, I'm not working with you guys. I'm not going to set myself up and our firm up for failure. It's like, wow. That kind of turned me on a little bit. So I clearly pursued this guy, right? And pursued him and pursued him and pursued him until he relented. So I'm not sure how it worked, but also Doug Nolan pursued him. So we kind of went after him with everything we had. We were the first pharma company that he actually agreed to work with. We're the first pharma company Press Ganey's ever worked with. But what happened from that event was it created data, factual data that we could share with the organization to shock people into consciousness, that we weren't all that. We needed to improve. If we were really going to live the value of patient focus, patient centricity, and deliver on real value, we needed to change our way. So what that did is change the culture. So much of what you want to do is in many cases, just do top down. Fix the process, get after it, we're doing this from now on, it's a mandate. When you're trying to build a collaborative environment and change the culture and be able to deliver on this, you can't do it with just the commercial organization or the medical affairs organization. It's got to be with research, development, medical affairs, and commercial, all pushing together, all pushing together. Sharing that information was humbling across the organization. It was humbling from a standpoint of people said, okay, we've looked inside, and we have a long way to go if we're going to be patient-centric. So that data point was really the turning point in terms of people saying, okay, you know what, maybe we could do better. So for me, that was the aha that now target product profiles had an urgency to incorporate how we would have a patient focus. In terms of what we did in terms of ensuring that anything that a patient touched made sense, and we got their input was also critically important. And getting the input from not being behind the glass, but being able to sit down and talk directly to patients about what's important to them.